Well, good afternoon, everyone. Welcome to the Children and Families in Temporary Accommodation session. My name is Sam Pratt. I'm from the Shared Health Foundation, and alongside me is Kate Standing. Kate, can you introduce yourself, please?
I'm Kate. I work for Justlife. I'm the networks manager at Justlife in one of the areas based in Brighton, and also sort of oversee the Brighton and Hove Frontline network. So quite sort of connected with the Frontline network. So yeah, hello and welcome.
Fab. So this session will be all around children and families in temporary accommodation. This is a somewhat of an expertise of shared health, and I'm going to be sharing what we do on the front line and the policy and lobbying work that we do as well. And also, how do we look after ourselves as teams? We're all working incredibly hard, working with the people that we work with, but also we've got to look after ourselves to make sure that we can be resilient and give great care and support to the people that we work with. So, in a classic Zoom fashion, just going to share my screen. Okay, Kate, can you see that okay? I can't see you if you are nodding.
Oh yes, yeah, that's good. So I had the mic.
Great, thanks. So yes, Shared Health Foundation, we are a not-for-profit based in Oldham in Greater Manchester, and our aim is to reduce the impact of poverty on health. And there's our Twitter handle if you want to come and follow us and see kind of what we're talking about. Shared Health, we're a not-for-profit, so we're philanthropically funded through the Oxford Charitable Trust in Manchester, and we're a mix of health clinicians and people with non-health backgrounds. So we're a clinically led and evidence-based organisation. Our CEO is Dr. Laura Nielsen, who is a A&E paediatrician, and we've also got A&E staff nurses, GPs, clinical psychologists, and over the years we've worked with dietitians and other nurses and midwives as well in our team. We're health focused and all about poverty and deprivation in the most tough neighbourhoods around in Greater Manchester, specifically in Oldham and Rochdale, but our work is very far reaching. We work across sector and we innovate grounds project that's on the ground, but then also lobbying for system change as well. So we're doing kind of both ends of the spectrum to make lives just that little bit easier for people who are really hard done by. We're also partnered with two other organisations. So Hope Citadel is a not-for-profit based across Greater Manchester, delivering GP practices in deprived areas in the bottom 10% of deprived neighbourhoods. And Focus Care is also another not-for-profit that is providing holistic wraparound support for households with multiple complex needs in and around primary care. So Hope Citadel and Focus Care are kind of the NHS funded arms of the work that we do, and Shared Health is the kind of the charity that gets to do kind of the innovative work that feeds into the other bits of work. So even though Shared Health is about there's about 20 of us, the whole team with all three companies is about 200 right across primary care across Greater Manchester. But what I'm talking to you about today is about families living in temporary accommodation. This is just a smattering of stats that are now out of date because the data comes out every few months. There's 145,000 children who are homeless that are living in temporary accommodation. There's 112,000 households, and out of the 145,000 kids, 20,000 of them are babies who are under one. Now compare that to rough sleeping, where there's about 3,000 adults that are rough sleeping across England. The numbers are just astronomical compared to what the media and what kind of public and policy and stuff is talking about. We hear a lot about rough sleeping, and there's a lot of great work that goes into that. I'm not knocking that at all, but actually the reality and the crisis of the homelessness situation at the moment in England is absolutely massive, and it doesn't get talked about enough. So we're talking about children and families living in TA today, and just the kind of the consequences we have on them. Now, we started working with families around about 7 years ago, when Shared Health first started. It was one of the kind of cohorts that was really underrepresented in Greater Manchester. And we did a bit of digging, and 7 years ago, we didn't know much about TA, and we've just learnt loads over the past few years. We found out that there was no holistic approach to homeless families anywhere across Greater Manchester or across the country. if there was, we didn't know about it. So if you are doing something amazing, please get in touch with us. We'd love to hear what you're doing. But at the time, we just didn't hear anything about it. So we decided to start our own on-the-ground project, which I'm going to show you a short video now. Hopefully you'll be able to hear this.
The families we see are really impacted by poverty on many different levels, and we see this from maternal health through to the first 1,001 days of life in children that have no voice but are actually impacted, and their health is impacted in the years to come. At the crib, our basic level of response is referrals that come in from healthcare professionals that are asking for practical provisions for families, and we enter into that family's need at that point of crisis. As we move forward into building that relationship of trust with the family, often we then are able to either offer them an extended time with a GP so that they can discuss any health concerns that they may have. We may also be able to book them into our therapist, who will give 4 sessions, which is purely about them and helps to hold them in that moment of crisis so they can make the next right decision. The crib is a great base for us to offer our focus care practitioners. It's a holistic model of care, which means that we really stay with families for a long period of time until they're settled in their own accommodation. Focus care practitioners can walk with those families and ensure that they are able to access care within the health sector, but also in social care. And when we eventually leave families, we are leaving them in a more stable place. So the benefits to our service are children have had their immunisations, we've had families registered with a GP practice, we've had families and women access therapeutic support, we've had ladies that have attended for their smear test and avoided a further cancer pathway, and we've had families that have been able to find school places for their children, so have been able to continue with their education. If you're really passionate about vulnerable families within your community, then please get in touch. We'd love to speak with you and come for a visit.
So we've got 2 spaces in Greater Manchester, one in Oldham, one in Rochdale, that is running this holistic healthcare for families that are in temporary accommodation. And if you go into the space, you'll see that it's big, open, beautiful white space with nappies and Moses baskets and hygiene essentials and stuff like that. And at the front, you kind of think, oh, it looks a bit like a food bank or like a baby bank type of thing. But it's not just about the nappies. We're not giving out nappies just to make ourselves feel better because some families can't afford it. It's about all that public health interventions that are so often lost when families enter the homelessness system. And what we can find is that when families enter it, they lose so much hope. And when you lose hope, then like your mental health, your physical health, and all your outcomes suddenly just plummet at that. So what we try and instill in the families and especially in our teams as well, that actually what they've gone through produces perseverance, and what that does is produces character, which produces hope. And if you don't have hope, then you haven't really got anything, have you? And mostly we are surprised by how much our families bounce back from that, which is absolutely incredible. This is Danielle. She's one of our absolutely amazing families that we've been working with for a couple of years, who story you can read briefly on the side, that she got evicted, she had nowhere else to go, ended up sofa surfing, just packed their bags and off they went. But little Clayton, who's with her there, is a child with multiple disabilities and multiple kind of health complexities. But when she entered the homelessness journey, the system just forgot about her, because there is no link up between health, education, housing, social services and things like that. When families enter those systems, it's a complete just, you get left out on your own. The systems had forgotten Clayton, and his health outcomes were suddenly plummeting because he was in this accommodation that no one knew that were there. But when you put the support around him, you get the right professionals involved. I think there was over about 20 health professionals working with Danielle and Clayton over the 2 years that we were working with them. And suddenly he went from a child whose outcomes weren't very good to absolutely thriving. And what we did wasn't particularly groundbreaking. We gave them some time, we gave them some love, we gave them a few practical things as well. But most importantly, that we were an advocate for them, because, as you know, the housing and homelessness system is quite complicated. And if you're a family that has fled domestic violence, if you have faced racial discrimination, if you've got a disabled child, if you've got multiple children and you're on your own, like there's loads of complexities that really just go against you. And this is an interview that we did with Danielle, who'd said that you might have a dark day now, but in years to come, a couple of months' time to come, when you're over and out of that dark place, you will look back and you think, I did it. I did that for my babies. And if you could do and get through that, then you can conquer the world. And it's just so moving hearing her talk like that, when actually a couple of years prior, her life was very different. And we see story after story of things like this happening again by, if you put the right support in place, then the health, physical, social, emotional outcomes go up massively. We really want to see lives changed, which is why we do the work that we do. We want to see miracles happen in the most intense situations. And we say that because we've seen it happen. We've seen, ill children that actually their outcomes go up. We've seen kids that were taken into foster care where the mum was really struggling. We're able to put the support in place, and then a year later the kids were returned back to them. We've seen mums who had fled domestic violence and then had started apprenticeships, and we've also seen parents that have come off substance misuse and things like that, when actually what you might think is the most traumatic part of your life, going into temporary accommodation and becoming homeless and fleeing that perpetrator, or losing that job, or losing the house because you can't afford the rent or anything like that. These types of experiences are really, really tough, but as long as the right support is put in place and it's well supported within the system, not just the charitable sector where we are, but the system takes it on and is responsible for the safeguarding of these children, then we'll see the sons and daughters that are growing up homeless at the moment absolutely thrive further on. We've got 145,000 kids here, and 20,000 of them are babies. And the most formative part of a child's life is those first 1,001 days from pregnancy to when they're about 2. And at the moment, there's not a lot of great support going out for babies who are homeless. There's little bits of pockets around there, but we would love to see, next few weeks when a new government is formed, that they actually really take the early years really seriously, and put funds and plans into place to ensure that the children that are completely voiceless really get listened to. Speaking about children that are voiceless, part of shared health is that we like to be really, really nosy. You might have seen over the past couple of years, if you've seen me or my colleagues speak at different events, about the mortality link between temporary accommodation and child mortality. We asked the National Child Mortality Database a couple of years ago if there was a link between child mortality and TA, and at the time there wasn't any kind of official database around it. And their brilliant team of data nerds looked through about 3,000 different case studies and found that at the time there was 34 children that had died in temporary accommodation, with their accommodation being a contributing factor to their death. And then a year later, it had risen to about 55 deaths, and 42 of them were babies. And I don't know if I'm still on camera or whether you can just see my slides, but the size of a 1-year-old's shoes is absolutely tiny. And these are the children who didn't get to choose to be homeless and didn't get to choose to be in the environment that they are. But these children were dying out of the lack of the system that was supporting them. So we were absolutely, honestly, enraged that this was even happening in the world's 5th largest economy, and this inequality was happening. So we released the data through the all-party parliamentary group for temporary accommodation that we co-run with Justlife. And we got front page news, and we were like, hurrah, we've made it happen. The government will listen, and Rishi Sunak will call me personally to thank me for all the hard work that I've done, and then things will be changed and lives will be saved. And this is what? Nothing happened. So there was a bit of media kind of hoo-ha about it, and some of the politicians were slightly bothered. And then that was it. And so we went around all the different conferences and meetings and things like that, constantly talking about the inequality of these children dying, where no one knew where they were and why they were dying and all this type of thing. And it was down to a lack of safer sleeping opportunity. So over Christmas last year, we started a Christmas campaign, which I'm going to show you now.
This Christmas, thousands of homeless children face an increased risk of sudden infant death syndrome due to their living conditions. All homeless children should have the right to a safer, secure and more peaceful experience of their homelessness journey. Currently, cots and Moses baskets do not have to be provided in temporary accommodation. Tragically, since 2019, at least 34 homeless children have died while living in temporary accommodation. Most of these children were babies under 1 year of age. This truly is a silent nightmare. Your voice can help protect the lives of the voiceless. Sign our petition today to ensure that they have a safe place to sleep.
So we started this campaign called the Silent Nightmare Project, and we didn't really know what was going to happen. We knew that the Homelessness Code of Guidance didn't ask for cots or Moses basket, and there was nothing about 0 to 1s or babies or anything like in that. So we thought we'll get the campaign out. We made this in our little office, and off we went, and we'll see what happens. And then we hit front page news of the Metro, which was quite interesting. So we were in London at the time, and then everyone on the tube all had the Metro things in front of them, which was a little bit bizarre. Got lots of media coverage on ITV and the BBC and different things like that. Political campaigns to get things moving. We can't have done any of this without the data and without the frontline staff giving the right data and writing it down whenever they thought it was necessary. So the data from the 55 deaths was only recorded because frontline professionals thought that it was relevant to that child's death that was needed. It is very likely that the numbers are going to be much higher for just by a data collection point of view. So the 55 deaths are the data that we've got from the frontline network that are dealing with these families. So one massive thing that I can say to people is that data absolutely is crucial. So the more we know about what our families are exposed to, what they're suffering through, what they're going through, what the policies say that means other things that happen, and what's the kind of consequences of other policies as well. It's really vital that we take as much data as possible and work out a way of sharing that to make sure that the lives of the children that we work with are protected, so they are healthy, they are safe, and they have a more peaceful experience of their homelessness journey. But it's not, we can talk about the policies, we talk about the politics, and we can talk about the kind of, even though all the data stuff that I've just said, but it comes down to people. It comes down to these families, especially this family that we've worked with, who live on 3 single mattresses, because that is all that's provided. These 3 beautiful girls who have fled something that they should have never experienced in the first place. They get plonked somewhere, the house might not be up to scratch, the support isn't there, they might have to travel on multiple buses to get into school, they have less access to the NHS, it's more barriers to access other things as well, and their health and social and physical and mental and emotional, things that in their lives do plummet because of the situation that they're in, and the poverty that they go through really massively affects their health, and their homelessness is a massive part of that. Adverse childhood experiences are a massive thing that we work with and are trained in working with our families, and homelessness is not classed as an official adverse childhood experience, even though we can probably all agree that homelessness is pretty traumatic. So we've got to always think about the people and the children that we're working with, which is why when we took a photography project to the Houses of Parliament, and even Michael Gove got to see the exhibition for about 30 seconds before he tottled off somewhere else. You've got to do both the on the ground working with these wonderful families to do kind, compassionate care, whilst also doing the lobbying and the system change, because you can't do one without the other. As you can see, we get ourselves out quite a bit, chatting to lots of different people, but the more evidence and the more stories and the more data that we can have as fuel for the next government, like the better, really. And also having more partners and more people to work with as well, because at the moment there's not many people fighting the fight for homeless families, and it needs to be a massive national, basically whole restructure of what we think about homelessness. Children massively outweigh the number of rough sleepers, but the chatter is all about rough sleeping. So let's flip the lid on that, please. What stuff that you can do today? So I won't go into too much more about the costs. I've talked enough about that, but a cot for every infant for every night. I had a local authority email me a few weeks ago who said, we've got a family in a B&B, they've got nowhere safe to sleep. There's a baby that's very newborn, and any chance you could give us a cot? But this local authority was hours and hours away from us, and this was post the guidance being updated. Every night counts, because you can't just put a family somewhere without somewhere safe to sleep and then assume that everything will be all right. That all it takes is one night of something catastrophic happening for that baby to unfortunately die in their accommodation. It's a safeguarding issue that everybody needs to take extremely seriously. And it's not that difficult. Cots and Moses baskets are a life-saving piece of equipment that is very cheap to do. Said about the data, the more data we can share, the better it will be for our families. If you work in primary care or secondary care, please code that the families live in TA, share it with your colleagues. Code accidents and near misses as well, because we're also seeing lots of different data points coming through, but they're not always down to their housing situation. Secondary there don't code temporary accommodation at all. So that's another kind of thing that we might be campaigning later on. A notification system. So health, housing and education don't have an official link up between each other for when families enter a homelessness journey. We are trialling it in Rochdale at the moment, where when a family enters the homelessness journey, that the school and the GP are notified the next day via email with the parents' permission and guidance of what the school and the GP can do to best support the family. Because the more of the professionals that are relevant, that know what the families are up to, the better the outcomes of the children will be. We know of a family who, as a child, was living in a really dangerous shared accommodation when she was homeless, and her behaviour was escalating at school for obvious reasons, because she was having lots of trauma from the unsettled place where she was living. She nearly got excluded, and all it took was us going into the school, explaining the situation, and the school said, "Oh well, if you told us in the first place, then we would have put something in place." So they did put something in place, lots of support, and she's completed her GCSEs and now she's at college. Her educational output would have been very different if she managed to get excluded because of a lack of a joined up approach. And then we want you to also challenge as well. So there are very different opportunities of working with singles and families. Singles have a whole new different sets of complications that families do, and they need to be treated and worked with and cared for and loved for in a completely different way that families do. So we're still seeing B&Bs and shared accommodation mixing vulnerable single homeless adults with vulnerable homeless families in the same accommodation. It is a massive safeguarding risk. I know there's no accommodation, I know there's no social housing, I know everyone's really knackered, but how many incidents are we willing to risk? Especially for the cots as well, like how many children have to die before we make it a serious thing? How many children need to be exposed to lots of things that they shouldn't be exposed to before we consider this absolutely serious? So please, where you see it, I want you to challenge it. If you are inspired about the work that we're doing, the work that we're doing is replicable and it works in local authorities when it's in partnership. So if you want to know more about that, please come and talk to us. And tell us what's going on. Tell us if you're doing something really interesting. We really want to know about that. We will champion what great work is going around all over the country. We're not here to replicate or duplicate or copy off anyone else. We're all here working together. So please tell us about what's going on. We'd love to know. I just want to, I forgot to say, if anyone's taking any screenshots of that video, please don't share them publicly on that one. We've got the family's permission to share it within a context like this, but just not on social media, if that's okay. Now we come to a bit of talking about specifically about you amazing group of frontline people who work tirelessly every single day. And it's knackering, isn't it? It's really hard work, and there's less funding, and the work is harder, and the resources are thinner. So we've got a couple of videos I'm going to show you now, which is about basically how do we manage stress and how do we keep each other accountable in the work that we do. It's really tough work that we're doing, but we've got to look after ourselves, because you can't pour from an empty cup, and you've got to be able to support your team so you can support the people that we're working with. So I've got two videos to share with you. They're about 4 minutes each or so. One's about managing stress and one's about the zone of fabulousness, which you'll see all shortly what on earth I'm on about there.
Hi, my name's Jen Davis. I'm a clinical psychologist in the Together service. One of the concepts that we use a lot is a concept of containment, and that's what I'm going to talk about today. So in this kind of demonstration, this is going to be the person who's experiencing homelessness, and this is going to be a staff member that we're going to talk about. And we're going to say that the water is representing stress. So if we imagine we have someone who's experiencing homelessness, a woman who has been homeless for some time and is just discovered that she's pregnant. So if we imagine the stress that she's experiencing, she already has kind of toxic levels of stress because of her past trauma, and she carries them around in her body and her mind all the time. The fact that she's homeless as well, that obviously increases the stress. So this is something that she's living with all the time. And then actually what's happened, unfortunately, last night, we'll say that actually where she thought she was quite safe, something was stolen from her. Something not of monetary value, but something that was really personal to her. And that's another level of stress. So she's really full. You've actually been working with her and you've been feeling quite hopeful because as she's newly discovered pregnant, this baby brings an opportunity for change and hope. You're due to meet with her, and what she needs in this moment when the stress starts to spill out is for you to be able to say, I understand what's going on. That's really hard. It feels really unfair after everything you've been trying to do. I can see that you're angry, you're really distressed. And actually that kind of being alongside her helps to contain her and her distress. It might not be that she can understand any of the words you're saying. That's not necessarily what containment is about. It's about the presence and communicating that okayness and ability to absorb the distress. But that is really what she needs so that she can, regulate herself a little bit more and not turn to previous coping strategies, which, let's say, for example, was using substances for this woman. And she manages to avoid doing that with your support. Now that is imagining that as a worker, you have been stress-free when you arrived to work. But let's just say that that's unfortunately not the case. That actually last night you had an argument with somebody close to you. So you coming into work a bit distracted and full of the stress from that as well. And on the way to work, actually, because you were kind of a bit distracted, you almost got hit by a car as well. So stress levels up even further. There's a bit of shouting that happened after that as well. So you're kind of arriving agitated. And then when you get in, you find that unfortunately a colleague is off ill, and that means you're going to have to cover some urgent work today, which you just don't really have space for in your diary. And then to top it all off, you go to make yourself a brew and you're out of the thing that you usually like to drink first thing in the morning. There's none in the office. So you are full to the brim of your stress. And what that means is when you go to see this woman who also has her own stress going on and she spills out, you don't have the capacity to absorb what she is sharing with you, her distress. You can't, it spills out. So what we say to people when we're working with them is, who is your bigger bowl? We all need a bigger bowl to be able to contain our stress and to be able to say to us, man, you've had a hard day. Like, that sounds a nightmare. What's going on? You said there's something that happened at home. You're all right. What's happening there? Here, I'm going to nip to the shops. I'll get you your drink. What do you fancy? Sit down. I'll put the kettle on. And I know you've got this work coming up and that's a bit of a nightmare, but can I take anything off you so you don't have to do that today? And through other people being able to contain us, then we're more able to be able to contain the people that we're working with. So this is kind of the main idea that we want to sort of talk about today, communicate today. As an organisation, as individuals, who is your bigger bowl, or what activities are your bigger bowl that helps contain and regulate you so you're able to be available for the people you work with? Hi, my name's Jen Davis.
So I wanted to have a little think. Who is your bigger bowl? Who is the person or people or team in your workplace where you can just offload and just shake it all off before you go back out there? Because I'm sure we've been in times where we might not have said the things that we wanted to say, or we've done it in the tone that we didn't really want it to do, because there's lots of other stuff going on, because we're all humans as well. We're allowed to have bad days as well. And the more regulated we can be ourselves, the greater the care that we can give to the people that we're working with. Our next video is called The Zone of Fabulousness, and it's about keeping us, basically keep us in check with how we're working with the people that we're working with. How do we keep us down in that zone where actually we are absolutely fabulous frontline workers, as opposed to going off slightly off on the edges. And I'll show this video now.
Hi, I'm Maria. I'm a trainee clinical psychologist and I work within the Together service, which is an infant parent attachment service. So today I'm going to be talking to you about a model called the Zone of Fabulousness, which was devised by Vicky Reynolds, who does all sorts of work within society. So she's an activist, she's a therapist, she's someone who strives to kind of work towards social justice. She does a lot of activism within the community and therapy as well. So the Zone of Fabulousness is a model that explores worker burnout by helping us focus on the client. It places the client at the centre of the model at all times and considers whether we are holding ourselves close to the client or whether we're moving away within our work. So burnout can manifest in two common ways as described in the model. So we have enmeshment and we have disconnect. So in enmeshment, we can form relationships that are too close to the client. They become very, very intimate as well. They can result in transgressive relationships that are cross-acceptable. Those relationships can often be intrusive, like I said, crossing boundaries, and are not really sustainable long term. Clients may see staff as heroes in this zone, and staff can just end up overworking themselves massively. And then on the other hand, you've got disconnect, which is where we move far too away from the people that we're serving. It results in disconnection from our clients. Staff may often use avoidance or numbing to get through the day, bringing often negativity within the workplace and using it to keep everyone away. So we should aim for a middle ground, which is a zone of fabulousness. In this zone, we're working in solidarity with other workers, and we're placing the client at the centre of our work at all times. And we're working collectively together. We can offer each other critique as staff members within the team, whilst we look after each other collectively. And it's important to recognise that if someone is heading towards a zone of enmeshment or disconnect, we need to offer them a non-judgmental but supportive critique to bring them back to the zone of fabulousness. It's important, in order to be able to do this, that we have pre-existing relationships which involve respect and dignity to do this effectively, essentially. So it's important that we have someone who has the moral courage to bring us back to the zone of fabulousness. If we stay in the zone of fabulousness and work collectively with the client at the centre of our work at all times, then we can hopefully reduce burnout and create long-term sustainability within our work. When everyone works towards operating in this zone, we are connected through collective ethics and morals, bringing in believed-in hopes and supporting and encouraging each other together. I've currently done a lot of work within a temporary accommodation setting within the staff team, helping them think about different ways in which we can end up burnt out in our work and how we might operate in the zone of enmeshment or disconnect, understanding what can lead us to operating in those zones and how to bring ourselves back into the centre of the zone of fabulousness. There's a lot of helpful resources and worksheets on the Vicky Reynolds website that can help you do work within the team and think about this zone and what can lead to burnout and help us bring back client-centred care and working together as a team. Hi.
So I'm sure you might recognise some of the case studies in there, whether it's the disconnect or the enmeshment. I mean, we're all human. I'm not saying that if anyone has straddled into those kind of zones that you're a bad worker. Not at all. Like, it is a really tough job out there, and what we can do is just keep each other in check and look after each other and be kind to each other, because we can't do this on our own. We have to be doing it as a team. And Kate is going to come now and talk a little bit more about how do we advocate for the people in temporary accommodation, and talking a little bit about kind of the work that Justlife does.
Hi there, thanks Sam. as you can see on that slide there, so my slides aren't so pretty and stylish as Sam's, but yeah, so I've worked for sort of Justlife, and we're an organisation that exists to advocate for and with people experiencing homelessness in temporary accommodation. I'm going to do the classic next slide, please. Thank you. So I'll just give you a little sort of a quick whistle-stop tour about sort of Justlife and what we sort of do. So so we sort of focus on sort of people experiencing homelessness in temporary accommodation. We have some key areas of sort of focus. So we actually started in sort of Manchester, I think about sort of 15 years or so ago, and we also have sort of service in Brighton and Hove. So this is the focus of our sort of services, and so. Again, we sort of focus mainly sort of in terms of the service delivery and sort of single sort of households, and I suppose, and that's a sort of maybe sort of Sam was sort of reflecting on that sort of reflects on the wider sort of homelessness services and organisations. We've often been historically very sort of focused on sort of single homeless sort of households and maybe sort of rough sleeping and different sort of forms of homelessness that way, and not necessarily had our eye on the ball about what about sort of families that are experiencing sort of homelessness, and because that can sometimes have been a bit outside of some of the community and voluntary sector sort of services and organisations that maybe sort of bubbled up, where they sort of seen and sort of meeting a need, because it has been very much and still is a hidden homelessness issue. So some of the services in Brighton and Manchester. So we provide sort of one-to-one support for sort of people in a sort of a mixture of sort of different sort of ways. So if some of you might have been on one of the health inclusion sort of sessions earlier on today, and you would have sort of seen some of my colleagues there sort of speaking. So we have in Brighton sort of a team of health engagement workers. So they're really sort of focusing on sort of supporting people and engaging sort of in health services around when they're sort of living in emergency and temporary accommodation. But we also, out of those pieces of work, and also in Manchester, we've got we've got an actual sort of centre that people sort of can go and sort of visit, and sort of, and there's one-to-one support there. But we also sort of notice as people sort of moving on, and we're sort of supporting people addressing sort of those sort of needs and issues that they need sort of help with, that actually there maybe there's also that importance of that social connection. So we have some social connections sort of projects and befriending sort of projects and things as well. So it's just been services that have just evolved as we've sort of grown, and just sort of meeting different needs as we sort of noticed them. Also, when we started a very small organisation, we've always had that sort of the bigger picture in mind. And again, as Sam's sort of sharing, that again, we can be doing stuff on the ground, but it's important that we have that evidence and data, and then what do we do with that? So right from its inception, there's always been sort of a research and policy sort of elements to it. So, and as Sam was sort of sharing as well, so we're sort of co-secretariats for the APPG. I can see a typo there. Double APG, that's a new thing. The APPG, and also sort of doing other sort of pieces of sort of research. Actually, a little while ago, we had a worker that was sort of doing some work sort of with out of placements, out of area placements, and then they shared sort of their sort of findings and things on just sort of how that was sort of working, and some of the challenges sort of around that when somebody's placed out of sort of area and disconnected from their sort of support networks and things. Again, we might be necessarily sort of focusing on single sort of households with that, but again, you can translate that to families sort of too, where they might be needing to sort of getting sort of 2 buses across a town or sort of city to get to school, and things like that. So we've sort of been aware of some of those things, and started to sort of put some reports together, and just sort of sharing that sort of learning. So that's some of our sort of national sort of work. But we also have sort of the temporary sort of accommodation sort of frontline network, which I'll tell you a little bit sort of more about, and just some of that other wider sort of things. And again, when we're talking about national stuff, obviously the APPG is sort of more focusing in sort of England, because also we've got all 4 nations, and they're just sort of devolved sort of governments and areas of focus. But I think again, it's sort of just like we are, some of the work we're interested in all 4 nations. So the other sort of areas and things that we sort of cover is like our networks and sort of the temporary accommodation action sort of groups. So this is focusing a little bit sort of more, so the tags, as we call them, temporary accommodation action groups, we have them across the country. I think there are about sort of 9 sort of tags in existence at the moment. And I think I might need to go on to the next slide, please. Actually, if that's okay, Sam, I'm getting ahead of myself. So I'll just tell you a little bit about the temporary accommodation action group. So yeah, so we've got about 9 across the country. We've got in Brighton and Hove and East Sussex, West Sussex, and Bristol, and I think we've got about sort of 5 in sort of London. But it's very much focusing on finding sort of solutions to local sort of problems. So it's getting lots of the different sort of stakeholders in a local sort of area sort of around the table. And working together. So as I said on that last sort of slide, that we do sort of, although as in terms of our services, we often sort of focusing on sort of single households. I think some of the conversations and the issues in sort of tags, it is very much around sort of families in TA as well. And so I can sort of urge you, so if you maybe are in one of those areas and you want to sort of to connect in with that sort of tag, but we also have on our website, so we can sort of share links to this following this sort of event. We also do have sort of guidance on how you can set up your own sort of tag. So we've been sort of learning and practicing as we go, but we've got some sort of guidance and help. We can provide some support to sort of local areas if they want to sort of set up their own tag, because like I say, it's really it's helpful just getting all those different stakeholders around the table. So the local authority, maybe sort of local organisations and sort of charities that might be sort of providing sort of support. Obviously those with lived experience as well, and just getting that and just trying to find some of those sort of local sort of solutions, while at the same time some of that can be either sort of feeding into the APPG sort of group, or even sort of feeding in if we had sort of tags in other sort of parts across our sort of nations, then again sort of feeding into sort of other sort of governments and things. So that's so yeah, just to make you aware that there are sort of support and things out there. Also, as I mentioned when I sort of first sort of introduced myself, so down in Brighton, sort of we also deliver the Brighton and Hove Frontline network, obviously part of the wider national sort of Frontline network, and I think because of the obviously Justlife being a partner sort of, and we've been obviously working a lot within the city of Brighton and Hove and all the other different organisations in our Brighton and Hove Frontline network sort of stuff, but I've been very sort of aware that at the same time there's this sort of national sort of increasing sort of need and awareness around sort of the issues around sort of temporary accommodation and the numbers of people living in temporary accommodation and the pressure that local authorities are under, and then the pressure that workers might be sort of under. And so we sort of we're looking to sort of tentatively explore whether to develop a temporary accommodation sort of frontline network, sort of that we can sort of reach out to sort of workers up and down the country and just start to sort of have a conversation, I suppose, around this sort of this issue, and start to find out who are those workers, who sort of almost self-identifies as somebody that's supporting people in temporary and emergency accommodation, and are those sort of workers within the council? Are there actually organisations that we're not aware of that are providing that sort of support, that because of connecting in? And then also, what are maybe some of the sort of issues that are specific around supporting people in temporary and emergency accommodation beyond some of the more sort of generic sort of frontline sort of services for sort of, supporting people in sort of homelessness. So starting to just try to understand that. So, but rather than setting up this another completely separate network, we have like a regular slot in the Justlife TA sort of network newsletter. So this is how you can sort of connect in, and that's where we just sort of share sort of information that we feel that might be sort of relevant to sort of workers supporting people in emergency and temporary accommodation. So that, and also sharing sort of, because obviously the national sort of frontline network providing sort of sometimes online sort of training throughout the year. If we identify something that that might be of interest, then we can share that sort of information. Just be a bit of a filtration system, I suppose. The other thing that we're looking to try and sort of pull together are some just sort of resources and even like a potential sort of toolkit that might be useful sort of for workers. So one thing we're looking at sort of developing is so something we developed in Brighton and Hove and sort of co-produced with people with lived experience of sort of temporary and emergency accommodation was a bit of an information sheet on, so when somebody is placed somewhere, where, you know, where are some of the local sort of the local shops and the local laundrette, where are some of the local sort of services, and that's been really sort of valuable. So thinking, well, can we sort of create a sort of a version that workers can just sort of fill in the blanks and sort of in for their local sort of area. So different sort of things like that, and we're very much sort of open to suggestions. And then the other thing we're exploring and sort of doing is just doing sort of one or two sort of online sort of meetups a year for those sort of workers. Again, where it's a space where we can just sort of gather and maybe sort of just connect up with others to see whether there are sort of trends that we're sort of noticing, that maybe it's not just in our own little sort of bubble, and actually there sort of is part of a bigger picture, and things that again we can sort of feed up through the different sort of systems that maybe, yes, Sam at Shared Health might need to sort of hear about or whatever. So the next one is actually sort of next week. So there's a few spaces left on that. So you can, yes, sort of sign up to that. And then also just getting that sort of updates sort of on the households and in sort of TAs of the APPG. So there's just some of those things too. But I think, yeah, I suppose my main sort of message is that if there's anything that's really sort of resonated with you sort of today, and or you want to sort of to learn more, or there are potential sort of conversations beyond sort of beyond this sort of session, because I think Sam and I are both aware there's only so much you can sort of cover in an hour's sort of session. Then there are some opportunities and platforms where we can perhaps continue conversations to start sort of learning sort of more, because yeah, I think it is something that we perhaps as a wider sort of sector haven't necessarily sort of been so sort of aware of, and we're still on a bit of a journey of sort of learning what are the sort of the key issues, and then once we start to understand that better, then we can start working on what can be some of the solutions, both in the bigger picture stuff, but also what can we do maybe locally. So that was probably all from me. Thanks.
And if you are free next Wednesday, or if you're not going to go to Kate's online meetup and you are wondering what am I going to do with my day, I really want to learn more about homeless families, come and trek it to Manchester. We've got a free conference. We've got Andy Burnham, the mayor, who's going to come and speak. And we've got loads of opportunities to learn more about the complexities, but also positive and hopeful solutions for homeless families across England. So it doesn't matter if you're a politician or work in housing or health or education or a volunteer, or whether you're just nosy and want to know. Yeah, we'll send the links out. Have a look on our website, find us on Twitter as well, and we'll love to have you over up in Manchester next week for our Dare to Hope conference. And of course, you get a free lunch as well, which is always great. And I'll leave you with a lovely little quote by the very effective orator Matilda. Even if you're little, you can do a lot. We might feel that I'm just one health visitor, or I'm just one housing officer, or I'm just one person. What on earth can I do? There's a massive amount of hope and love and care that you can give just as you are on your own. But of course, we want to work as well in teams to really do the best that we can do for the families and children that we're working with. These are my details. We'd love to answer any questions now. There's a few in the Q&A. I thank you very much for everyone's time. Okie dokie. So, Q&A. Wondering if the 55 children are in England or throughout the UK. Yes, it's just from England, the 55 children, because Scotland, Wales and Northern Ireland have their own data sets for child mortality. We don't have the data on those devolved nations yet, but it would be very interesting to see what the rates like compare between them. So I hope that helps. And if you want to have a look at all the other kind of data that's out there, the National Child Mortality Database release a thematic report every quarter. So if you really want a depressing read, you can read all about the 3,000 child deaths that happen in the UK, in England, sorry, every year. And as of October last year, we added an extra question to the child death overview panel that asked the question, was this child in temporary accommodation or not? So actually going forward from October last year, we're going to have much better data to know whether the kids were in TA, but we didn't beforehand. So Angela asks, it is not ideal for the families to be moved from hotels, hostels whilst they're on the social housing waiting list. What can be done about this? Sorry, I'm just reading and answering at the same time. I'm sorry, Angela, I'm not quite following it. I've got a bit of a brain fog here. Would you be able to type a little bit of extra context on that? I'm a little bit confused about what you're saying. Unless, Kate, can you jump in on this one?
Yeah, I was just trying to sort of, I suppose, I mean, that is part of the challenge again, is it, with people maybe in, I think some of the challenges when we talk about emergency and temporary accommodation, that can look quite different in lots of different sort of different areas as well. And it is, and sometimes people, are sort of moved around. So because obviously someone has to be sort of placed somewhere sort of that sort of night and it's not ideal, then they're moved again. And is that potentially a bit of a balance, a balancing act, and the pressures from local authorities? I'm not sure. I think that is part of the problem, and I think having sort of just sort of almost like it's for us to know that temporary accommodation it is a needed sort of security of tenure, and it's a needed housing sort of option, because it feels like sometimes it's not necessarily we want to put it away to one side, not really sort of properly sort of address it. And so maybe that's perhaps, it's that bigger sort of question of what can be done about it, is that we do need sort of decent sort of temporary accommodation. So while people are sort of waiting to be sort of moved into or to secure longer term secure accommodation. Sorry, that's a bit of a fluffy answer.
No, it does make sense, Kate, because what it was Justlife say is that temporary accommodation should be short, safe and healthy.
Yeah, short, safe and healthy. And that's, I suppose, what we need to be sort of working towards. And I suppose in each different local area, it might have slightly different solutions sort of on a practical level to what that might look like. But I think that is an issue where sometimes, sort of families are being sort of moved from different sort of types of accommodation, of different hotels and sort of hostels.
Yeah, Angela's just added that that knows of the families at different hotels and hostels. So there's like the constant moving of families and children in that is really catastrophic to the child's development. The more moves you do, the tougher it is. Ideally, you want to go into, ideally you don't want to go to temporary accommodation in the first place, because you want everything to be sorted out beforehand, but that's just not going to happen in the short term. You want to go to temporary accommodation that is safe, that is near to your original home, that is short as well, and you want to go into one place and then go into somewhere further, whether it's the private rented or whether it's social housing or whether it's somewhere else. Yeah, we see this all the time. We know a family that was moved 6 times in 6 months because of either availability or whether there was something happening at the hotel or something like that. So there's just it's very messy when it starts getting into the allocations of it like that. And I know it is really tricky trying to navigate the housing system and also the expectation of families as well, because if they get placed into an accommodation, they're like, it's great, that's fine, I don't mind being here, I'll get a social housing quite soon, and it's like it's going to be months, years longer in some parts of the country as well.
Yeah, and I suppose, I mean, again, in answer to what can be done about this, I suppose, as I mentioned, the temporary accommodation action groups could be a potential solution to some of those. Again, that's where if there's a particular issue in a particular area, that then getting those stakeholders around the table and talking about that and highlighting that actually this is having an adverse effect on those sort of families. So is there another way? Is there wiggle room around this, and just sort of ensuring if that's really sort of having that big negative impact, is it better for someone to stay in a particular sort of hostel or sort of accommodation place rather than moving around?
Yeah, someone's asked a question about how advocating for refugees would lead to remain to receive emergency and then eventually temporary accommodation. This is really tricky. We've got another project working from a doctor's practice that are working with refugees and asylum seekers going through the system, and I don't have all the answers to that one, unfortunately, because the duty homelessness, statutory duty situation is really complicated, as we know. And then when you start putting in the families and individuals that are coming through Serco accommodation, that's Serco run it up in the northwest, it's really complicated. We found that working with a doctor's practice and getting doctors to write letters on behalf of the patients has some effect. I'm not saying that that's like the tick box, but especially if they're in accommodation that isn't suitable, or they're in somewhere that isn't safe, or a lot of the times they're on cooking facilities in there. So if you're thinking just about the physical health impacts of having to buy processed takeaways, food all the time, the expense of that is absolutely ridiculous. So using all the professionals you can get hold of and to write letters and things like that. It's not a silver bullet to make it work, but we have found that has worked with us. Kate, I don't think Justlife do much work with refugees in.
No, I think generally it's fairly, again, that's quite specialist work, isn't it? So I think, again, what we would do is try and sort of link up with a specialist sort of organisations with that. And again, I think that sometimes it's that working together, isn't it, and bringing our expertise together to then find a solution. And sometimes, there aren't easy sort of answers. Yeah.
Okay, who is your bigger bowl then? Because someone's asking about working from home. It's really hard to have someone as your bigger bowl. And it is, like, how do you moan about something? How do you offload? And like sometimes we just need things and solutions and activities to be our bigger bowl as opposed to be a person.
Yeah.
So when you're stressed and working from home and life's a bit messy, or the dog's playing up and the kids or whatever, like what's your bigger bowl?
Yeah, well, it's a hard one, that, because I think, and sort of answering that question, when someone's working sort of from home, I think there is that importance of sort of team, and that can be easy when you come into a work sort of place. But I would hope that most people, if they're working sort of from home, that they should be part of a wider sort of team, and whether you could sort of connect up sort of virtually. I know actually it's just like we've got buddy system. And they don't necessarily need to be sort of workers that are working in the same location. And it's just that sort of that connecting up, and just having somebody that you can just sort of connect in with. So so maybe that might sort of help if you are sort of working from home. But I do sort of find that when you've got good a good network of team sort of and co-workers around you. Actually, we've done quite a lot of work around that in the Brighton and Hove Frontline sort of network, around sort of worker well-being and what does that actually sort of look like, and some of that in practice, because it is challenging work, and how do you sort of to sort of keep going. And actually, I think that little video clip was, I'm really visual, so I found that really sort of helpful. I'm going to hold on to that one, but and to ensure that we do. We do have that, keep that bigger bowl sort of around us, and it's and I think it's not always sort of like great big sort of things that have to. I mean, there's a lot of talk around obviously having reflective practice, and so that's really sort of valuable and has a sort of place. But even if that's not, you're not able to access that, or at the level that you might sort of need, then just that good team working, and just. I suppose it is. Maybe that is something we all need to do. Just take a pause after this sort of session. Just think about who is what is our bigger bowl, and just make note. Okay, that's what I can. If things find things get a bit overfilling, then this is what I need to do.
Absolutely, and the 5 ways to well-being can be a little bit simple in some cases, especially when you're in a busy workplace. You're just like, I don't have time to do some thoughtful breathing. But actually, if you're working from home and you just have a physical space that you can go to that just isn't your working space, if you've got like a little corner office, or you're working on the kitchen table, or whatever that is, just somewhere that's different that you can just reset and recalibrate if work is going a little bit pear-shaped and is a bit stressful. Just having that space that you can just concentrate on yourself, because I've said it again, if the you can't pour from an empty cup, and you just need to kind of make sure that you are regulated as best as possible, as much as you can.
And
the bigger bowl is their dog, and she hears all my frustrations. Absolutely. Dogs are usually really quite empathetic and kind of thoughtful when they're listening to you as well, because they love chatting as well. So absolutely.
Yeah.
If anyone's else got any other questions, please put them in the question. I'm just having a look through the chat. I haven't seen it through the whole presentation as well. So if there's anything else that I've missed, Kate, during while we've been going, then feel free to say it now.
I think most things have gone into the Q&A. Well, that's so Nick's showing, but just obviously highlighting the Vicar's Relief Fund for accessing accommodation sort of grants, and I definitely just advocate sort of using the National Frontline Networks of resources. They've got sort of obviously the other events and things throughout the year, and sort of those sort of grants and just sharing sort of news and updates. And there's loads of resources sort of available. So urge people to link in and sort of tap in and use them.
Well, if there isn't any other questions, any burning desires to say on anything, thank you so much for everyone for joining us today. It's been a privilege to share the work that we're doing. Please get in touch if you want to have a chat. I'm always up for nattering to people. Let us know what you're up to. Let us know if you've got any ideas. More importantly, let us know if there's anything that's going on that is not recorded, that is underrepresented, because the child death stuff came out of us being really nosy and going, something's not right here, we're not sure what's going on. So, the more we poked into it, it was like unraveling something, and it all kind of came out from there. So if there's a new trend, if there's any other inequalities that you've spotted that no one else is listening to, then that's what we want to hear, because that's what we're here for. So please get in touch. Mine and Kate's details are, I'm sure, will be around somewhere. Someone might send a lot of details around. And we hope to see you very soon. Thanks very much.
Great. Thank you. Bye, everyone.